The way that clinical trials are designed is to compare a drug versus placebo. And believe it or not, placebo is very difficult to beat. Because our medications are only partially effective, patients might only get 30, 40, 50% relief from any particular compound that's in development or any compound that's on the market. Placebo has a 30 to 40% responder rate. If patients come to a clinical trial unit and someone in a white coat has them sign a bunch of papers and gives them a pill that's, even though it's placebo, they get some benefit from that. And it's hard in clinical trials for the active drug, the drug that's being studied, to actually beat placebo. So many medications historically have not come to market because they haven't been able to beat placebo. And that's one of the kind of travesties of the world of analgesic clinical trials. So if a drug makes it to market, rest assured that the trials have shown that it clearly beats placebo. Now, one of the things we look at are what are the drugs that have failed and what are the drugs that are up and coming that we may actually have in the future. And it's a really exciting time for pain medications because we've uncovered these novel mechanisms of action, these novel pain pathways that traverse our peripheral and central nervous system. And the brilliant scientists, knock on wood, have developed targets or molecules that bind to these receptors and activate the receptors. And although there are some non-opioid products in development, ion channel, like sodium channel inhibitors, which we may actually see in the near future, there's also a lot of research going on to see, can we develop an opioid-like molecule which would give us the analgesic benefits, the pain relief that we might see with an opioid, but take away the baggage, take away the side effects that are associated with opioids. Not just the bothersome side effects like nausea and sweating and constipation, but the dangerous side effects, respiratory depression, likability leading to addiction and overdose. And there are a few companies that have actually made headway there.